Erectile dysfunction, ED, erectile difficulty, impotence. Many different names for one pretty scary condition that most men should know more about. What it is, how it works, and when it could potentially affect you and your sex life. Don't go anywhere, we're going to explore it all. My name is Helena Lista and I make videos that help you have the best sex of your life. And today I'm going to tell you all you need to know about erectile dysfunction. So let's start with the definition. ED is a difficulty with creating, getting, or maintaining a sufficient erection for a satisfying intercourse. So that means having an erection that is hard enough to penetrate a woman and to stay erect for as long as both partners need to achieve sexual satisfaction. The difficulty with getting or staying hard enough is something actually that almost all men will experience at some point of their lives. So this is actually extremely common, and as long as it happens to you only from time to time, there isn't really much to worry about. However, if this is something that becomes quite persistent and that really starts to affect your sex life and your sexual satisfaction, this is when you should actually seek help. And before we get to discussing different reasons for ED and different treatments and ways to deal with it, let's actually focus first on how erections work. The first step in obtaining an erection is stimulation, and that stimulation can be either physical, tactile, as in somebody is, or yourself, you are actually touching yourself, there's physical stimulation of the penis, or that stimulation can be psychological, meaning there is no touch, but they are maybe images that you are seeing or imagining or picturing in your head that you find sexy and arousing. Or maybe the stimulation is auditory and you're actually hearing some sexy words being whispered into your ear, etc. So once that stimulation happens, the information about the stimulation is sent through the pudendal nerve into the lower portions of your spine, into the sacral portion of your spine. From there, two things will happen. The information will travel all the way up to your brain to let you know that this is happening, that arousing stimulation is happening. But that information in the sacral portion of your spine will also activate your parasympathetic nervous system. These parasympathetic nerves will cause the release of nitric oxide into your genital area, into your penis. And the effect of that nitric oxide will be twofold. On one hand, the arteries leading into your penis will open up in order to allow more blood to flow into the spongy tissue in your penis. Plus, the smooth muscles within those spongy tissues will relax in order to create as much space as possible for that blood flowing in. So now we have all this blood flowing through those enlarged arteries into the penis, and then that engorgement and that hardening of the penis will actually kind of compress the veins in order to stop the blood from flowing out. So the arteries going into the penis are getting larger, and the veins that would normally allow the blood to flow out are getting kind of pinched and compressed by that engorgement, by that erection happening, to stop the blood from leaving your penis. So now we have this situation where there is a lot more blood flowing into the penis than actually leaving it, and that's what maintains the erection. And this exact situation will remain in place until either there is an orgasm, an ejaculation, or until the stimulation stops and all that extra blood will then leave the penis. So now that we know what's actually happening during an erection, let's see what could potentially go wrong. The factors that could get in the way of this process are either psychological or physical. The psychological problems come down to the fact that sex, getting intimate with somebody and getting an erection, like, this is not a purely physical process. There is a mental component involved. There's an emotional component involved. It's not just a sort of a push a button and get an erection kind of situation. Like, that's not how it works. Any man will struggle with getting an erection if he's feeling stressed or tired or depressed or angry and are upset with his partner or frustrated for whatever reason. And what that means is that even if everything in your body is working well and mechanically sound, your mind can still interfere with that process can still get in the way. So it is important to look there first. Is there something that could get in the way of you getting an erection when it comes to your mental and emotional state? And when it comes to the physical causes, first of all, there's your health, there's your general health. If you suffer from diabetes, high blood pressure, cardiovascular issues, heart disease, if you smoke, etc., these kind of things can affect the blood inflow when it comes to getting an erection. And a big problem that they can create, these different conditions can create, is narrowing of those arteries that lead the blood to the penis. So if your arteries have been narrowed by these different conditions and not enough blood is physically capable of getting to your penis, then you won't be able to get a good strong erection. Another issue that can happen health-wise is that yes, there is enough blood flow, your arteries are fine and they are allowing enough blood to flow into your penis. However, your veins that are supposed to get compressed and limit the amount of blood flowing out, like, they are not closing properly, and so they are allowing all that blood to flow out. This is called a venous leak or a leaky outflow, and basically it means that the blood is flowing in but then it's just flowing out. If you have had any surgery in your pelvic area, for example prostate surgery, or if you suffer from any other kind of neurological disorders, this might lead to damage to your nerves, and that nerve damage potentially means that the information that's meant to be sent from your parasympathetic nerves to the penis in order to release that nitric oxide, like, that information is not reaching the penis, and hence the chain of events that are supposed to lead to an erection gets broken, interrupted, and so an erection cannot happen, or cannot happen to the extent that you would like it to happen. It's also important to look at the medication that you are taking, because many different meds can actually lead to erectile difficulties. So this is definitely something to discuss with your doctor. Don't just discontinue taking any kind of meds or drugs that you have been prescribed to take, but particularly if you've recently started a new drug and you're noticing that it is negatively affecting your erections, speak to your doctor and see if there are any kind of alternatives or other ways that he can advise you or change your prescription in order for the medication to not affect your erections. And if you're not sure whether your ED is psychologically based or more physically based, a good place to start is to pay attention to your morning erections, because if you still wake up fairly regularly with a hard-on, then that means that most likely everything is working well with your health physically, and it's more likely the mental or emotional causes that are playing a role here. So let's talk about solutions or treatments for erectile dysfunction. And these will quite obviously depend on the nature of your erectile difficulty and on what's actually happening with your penis, with your body when it comes to your sexual function. Number one, therapy. Particularly couples therapy if ED is caused by issues or conflict or resentment in your relationship. I mean, who wants to have sex with a partner if there is tension and conflict between partners in the relationship? And even if your mind and your head is saying, yeah, I still want it, like, I still want to have sex, your penis might be saying something different. So resolving the relationship conflict in therapy can actually lead to the resolution of your ED problems. But if your erection problems are not so much based in your relationship, but more in your own overall stress and worry and anxiety in your body, or maybe even performance anxiety when it comes to being a good lover, getting erections, etc., then seeking therapy on your own could be a better solution here. Learning how to work through these different issues or challenges that you're encountering with your stressful life, stressful career, work life, etc. Or if you're not big on therapy, then at least learning some mindfulness techniques or meditation techniques that can help you get out of that monkey mind and get out of that stress, relax your body, and get into the physical experience that you're having, the sensual experience, sexual experience that you're having with your partner, so that the erection can happen without that stressful mind or monkey mind happening in the background. And maybe there are also other changes that you can make in your overall lifestyle in order to decrease the level of stress in your life and in order to create much more balance, relaxation, and even serenity in your life overall. The next one is quite big and something that I do recommend, as a kind of really important and big part of treating erectile dysfunction, and that is taking a better care of your health. In huge majority of cases, the erection problems are due to poor health and poor diet. If you eat processed crappy foods, if you drink alcohol, smoke cigarettes, or take drugs, if you don't drink enough water, if you don't exercise regularly, if you don't get good quality sleep, like all of these things will affect the quality of your erections. So taking care of all of these things and making these kind of positive changes and improvements in your overall health situation. For most men on the planet suffering from erection problems, that alone will resolve that problem completely. And I particularly want to bring your attention here to the health of your arteries, to the health of your cardiovascular system. I recently heard someone say, and I can't remember who it was unfortunately, but I heard someone say that what's good for your heart is good for your penis and your erections. And it just makes so much sense because it is about your heart pumping the blood, sending it down through those arteries into your penis and keeping it there for as long as you want to have an erection. So the health of your erections and how hard they get and how easy they are for you and how long you can maintain them, like that is so strongly linked to your cardiovascular health. So when you are making changes in your lifestyle, in your exercise routine, in your diet, in the foods that you consume, keep that in mind. That as long as all these things are good for your heart, they will be really beneficial for your hard-on. There are also certain toys and accessories that you can use in the bedroom in order to support that hard penis. And here specifically, I want to bring your attention to cock rings. So those round devices that you put around the base of your penis and which will then in turn kind of create that pressure and that tension around the base of your penis, helping the blood to stay there for longer. And there are also different pumps that you can use to pump your penis, either using vacuum and air or water, and their effect is quite temporary, like they won't permanently have an effect on your penis, but they can really help in each particular sexual session. They can help your penis to stay harder. And if all else fails and you really need to get an erection, or you're in the process of working on your health and psychological problems and emotional problems, etc., but in the meantime you'd like to enjoy some erections and some satisfying penetration with your partner, then you can obviously use Cialis or Viagra. When you take this kind of tablets and medication, you will still need sexual stimulation. Like they don't just create an erection all by themselves, they just support that erection once the stimulation happens. So either yourself or your partner will still need to stroke and touch your penis in many different or some different pleasurable ways in order for that erection to happen. What's also important to bear in mind here is that many men report side effects when they take Viagra or Cialis. So just be aware of that when you are making that choice, and you can learn a lot more about this kind of drugs in my video here. I hope that this was helpful and that it shed some light on the real nature of erections and on what really happens when it comes to erectile dysfunction. And if you'd like to learn more about ditching erectile problems for good, make sure to watch this video next.